Some people say, I can't leave the house without wearing colored contact lenses, so I can't get the surgery.
Hello, doctor.
Yes, hello.
Today I'd like to ask you some questions about smile surgery.
Sure.
Do contact lenses affect the surgery?
Well, if you wear lenses for a long time, they can cause dryness. Contact lenses can slightly reduce tear film stability. Soft lenses have a milder effect, while hard lenses may slightly distort the corneal shape. We call this a contact lens warpage, and although it's temporary, it can cause slight changes in the shape of the cornea. In particular, temporary changes can be induced in factors such as the degree of myopia or astigmatism, the shape of the cornea, and the thickness of the cornea. In that case, we may not be able to obtain accurate examination results as expected. As a general rule, we recommend avoiding soft contact lenses for at least 3 days and hard lenses for about 1 week before visiting the clinic for your eye examination. The most important thing is determining whether you are a suitable candidate for surgery and what level of correction is needed. Since wearing lenses can affect the results of refractive surgery tests, we recommend not wearing them beforehand.
Recently, many women have been wearing colored contact lenses to make their eyes appear larger.
Yes, colored contact lenses.
My friends even say that the eyes with the lenses are their real eyes, and the eyes without them aren't really theirs.
These days, it seems like they're almost just considered part of makeup.
After surgery, is it not possible to wear these cosmetic lenses?
No, that's not the case. I think that's one of the biggest concerns people have when considering refractive surgery these days. Some people say, I heard I can't wear lenses after surgery, and if I can't wear colored lenses, I can't even leave the house, so I can't get the surgery. But it's not that you can't wear them at all. When you undergo corneal vision correction surgeries like SMILE or SMILE Pro, you tend to experience increased dryness in the early stages. If you wear colored contact lenses while experiencing severe dry eyes, they can worsen your symptoms. Therefore, we recommend avoiding them until your dry eyes have improved to a certain extent. It's not that you're completely unable to wear them, so for those who say, I really can't go without lenses, I tell them to try wearing them carefully about a week after the surgery. Start by wearing them for a short period, like 3 or 4 hours when you go out briefly, and if there are no major issues, you can gradually increase the time. For a more cautious approach, I generally recommend waiting at least 2 weeks before wearing lenses again. So it really depends on the individual, but in any case, it's not that you can't wear lenses after the surgery.
Some people say that wearing contact lenses for a long time can make the cornea thinner. Can long-term contact lens use make the cornea too thin to undergo SMILE surgery?
No, that's a common misconception. However, there can be temporary effects. When you wear contact lenses, the cornea can become hypoxic. As the eyes dry up, the lenses can draw moisture away and some tears may be lost. If you wear contact lenses in an improper way, the corneal thickness can temporarily become thinner. But because you stop wearing lenses for at least 3 days to 1 week before the examination, it does not cause the corneal thickness to appear thinner. So it is a misconception that wearing contact lenses can permanently thin the cornea to the point where surgery is no longer possible. There may only be a temporary slight thinning effect.
What are the side effects of wearing lenses for a long time?
Basically, the longer you wear lenses, the more likely you are to develop dry eye syndrome. That's a well-known side effect. Secondly, lenses are foreign objects after all. So when there's a barrier in front of your eyes, I sometimes say this: your eyes need to breathe too. Especially for corneal cells, like corneal epithelial cells, they need a good supply of oxygen to stay clear, healthy, and maintain their function. But when there's a barrier, it becomes harder for oxygen to pass through. When hypoxia occurs because of this, the body responds by causing blood vessels to grow more actively. So new blood vessels called neovascularization start to form around the cornea. That's why, if you look at people who have worn contact lenses for over 10 years, you can see tiny blood vessels growing around the edge of the cornea. But over time, even if you stop wearing lenses, those vessels don't disappear. So if this corneal neovascularization becomes severe, it can cause a lot of inflammation, and later on it can also interfere with surgery. When an incision is made in that area, bleeding can occur. So wearing contact lenses to the point where new blood vessels develop in the cornea can actually be very harmful to your eyes. Personally, I would say for more than 10 years is not ideal for maintaining good eye health.
And since you have to keep buying contact lenses, it's a cost that continues to add up over time.
That's right. In the past, people would take their lenses out, disinfect them in a solution, store them, and then put them back in again. Back then, people mostly used reusable lenses, but these days, daily disposable lenses are much more common. Good quality daily disposable lenses can cost around 2,000 to 3,000 won each, which means you may spend about 500,000 to 1 million won a year. If you wear them for over 10 years, that can add up to nearly 10 million won. So compared to the cost of surgery, continuing to wear contact lenses for many years can become a hidden expense. It may only cost a few thousand won each time, but over 10 or 20 years, the total cost can be several times higher than surgery. Looking at the long term, getting the right procedure at the right time can actually be more cost effective. If you wear contact lenses, the longer you wear them, the more strain they can put on your eyes, which may lead to side effects and complications. Considering the potential harm that long-term contact lens use can cause to your eyes, surgery can be a more beneficial option, offering benefits not only in effectiveness but also in safety over time. Another thing is, if you are putting off surgery because you think you won't be able to wear colored lenses anymore, that is a misconception. Whether you undergo ICL Smile or Smile Pro surgery, most patients have no problem wearing lenses after the procedure. With that in mind, I can say that surgery can be a more convenient and potentially safer option than wearing contact lenses.